Namaskar, I'm Shubhendu Ghosh. Welcome to Tracking COVID 2019. This is a special show where we bring together all the national and international updates on coronavirus outbreak, steps taken by the government administration, inputs by reporters, global developments and expert advice. All of this packed together in the next half an hour. Let's begin with the top 10 updates at this hour. Centre says COVID-19 in India still in local transmission mode and growth rate of corona infections in the country as compared to developed nations is low. Number of active COVID-19 cases in India reaches 1,117 while 101 persons have been cured and discharged, 32 deaths reported. Centre and Delhi government say that the migrant population issue is now completely under control. Prime Minister Narendra Modi interacts with leaders of social and spiritual organizations, urges them to spread awareness about importance of social distancing. Prime Minister Modi interacts with heads of Indian missions across the globe, discusses ways to combat coronavirus and the role Indian missions can play in assisting Indians abroad. In a big relief to farmers, government extends crop loan repayment till 31st May this year, allowing farmers to repay crop loans up to extended period at an annual interest of 4% without any penalty. ICMR approves first indigenously developed COVID-19 virus test kit costing just 1,200 rupees as against the present cost of 4,500 rupees per test. DRDO says it has developed indigenous equipment including multiple-use ventilators and isolation tubes to fight COVID-19 pandemic. WHO says no new countries, territories, areas have been reported cases of COVID-19 in the last 24 hours. And total number of confirmed COVID-19 cases near 7 lakh mark globally with over 33,000 deaths reported world over. Now let's first take stock of the key developments in India vis-a-vis COVID-19 in Ground Zero. Number of active COVID-19 cases in India has reached 1,117, while 101 persons have been cured and they've been discharged from hospitals. 32 deaths have been reported from the deadly virus across the country. Over 15 lakh passengers have been screened at the airports. Maharashtra and Kerala have the maximum number of active COVID-19 cases in the country. Meanwhile, the Indian Council of Medical Research is amplifying coronavirus test sites and more labs are being opened across the country. It has approved first indigenously developed COVID-19 virus test kit. The test kit will cost 1,200 rupees only as against the present cost of 4,500 rupees per test. It also said that 38,442 tests have been conducted till now, of which 3,501 were done on Sunday itself. 47 private labs have also been given approval for conducting COVID-19 tests. In the last 3 days, 1,334 tests have been done by the private labs. And Centre has reiterated that COVID-19 epidemic in India is still in local transmission mode, refuting some reports that it has reached the limited community transmission. Health Ministry yesterday said it took 12 days for cases of infection to rise from 100 to 1,000 and that the rate of increase has been slower than some of the developed countries. Health Ministry officials attributed the slow pace of rise in cases in India to people's participation and strictly following the social distancing guidelines and the collective preemptive actions taken by the centre in tandem with the state governments. They added that instead of panic, there is need for creating awareness about COVID-19.
We have to come out of the semantics, and we have used the word in a very limited context in a way to highlight what we are going to do action at field. Nowhere we are saying there is community transmission. It is only local transmission in this country. Let me repeat it. And we will be the first one to get back to you to explain that yes, there is community transmission in the country if need be. Because if it is going to be there, we will come back to you, and through you would like to inform community to increase our level of alertness and management at the field level.
And underlining the importance of social distancing, he said, one person's carelessness can lead to the spread of this pandemic.
कोई भी एक व्यक्ति लापरवाही करता है तो अब तक का जो हमने रिजल्ट पाए हैं, अब तक जो हमारी रिलेटिवली पॉजिटिव स्टेज है, हम फिर से जीरो स्टेज पे आ सकते हैं, हम फिर से फेल हो सकते हैं. तो इसलिए मैं आप सबसे रिक्वेस्ट करूंगा कि हम लोग हर तरीके से 100% अलर्ट रहें, 100% एफर्ट रखें कि जो गाइडलाइंस, जो डायरेक्शंस और जो डूज एंड डोंट्स सरकार की तरफ से पब्लिक में हम सबको बता रहे हैं, कृपया करके उन गाइडलाइंस का 100% अमल हो. हम इसमें 99% भी अमल जो है वो हमारे एफर्ट्स को फिर से हमें बेकार कर देगा. इसके लिए आप सबका सहयोग हमारे लिए बहुत ज़रूरी है.
And the centre has stressed that priority of the government at the moment is to augment the infrastructure to fight the epidemic in all its proportions. Home Ministry officials have said that centre is working in close tandem with the state officials to ensure that the lockdown is strictly enforced in all corners of the country. And my colleague Arun Sharma is joining us with more updates on phone line. Arun, it seems that the focus of the government is now to build up and prepare the infrastructure to deal with any eventuality.
That's right, Shubhendu, because globally, each and every country is combating the coronavirus outbreak, and they're trying to flatten the curve, the number of positive cases. They're trying to flatten the curve, but yes, they are not so successful as India is. Well, it took, as in yesterday's Health Ministry PC, it was yesterday clearly mentioned that it took 12 days for India to reach from 100 positive cases to close to 1,000 cases, whereas in other developed countries, this number is close to 8,000. So you can understand the fact that how government, is ensuring that we are in a position to flatten the curve. So only 1,000 cases primarily. Yes, various initiatives are being taken by the government as of now. When talking about the DRDO, yes, DRDO, as we know that this time it is developing the multifunctional ventilator #1. It is also coming out with a Make in India initiative of testing kits. But the test gets done worth 1,200 rupees. So that's the DRDO on one side is bringing the cost of the test down, and also developing these on a large scale so that the testing can be increased. Because as of now, 38,000 tests have been done, out of which we got the data close to 1,000 people, being tested. So now the focus of the government is to increase the test by developing various equipment. And on the other side, the DRDO is also developing masks, and now the private players are also being, brought in. Now the government has asked the automobile players to develop the ventilators. So Bharat Electronics Limited has also come out with, and they'll be developing 30,000 ventilators. So the big initiative by the government to flatten this curve of this COVID-19.
Darun, thanks very much for joining us with those inputs. We'll also connect with different colleagues who are reporting from different parts of the country. We'll now turn to Shishir Shelar, who's reporting from Mumbai. He's connecting with us on phone. Shishir, Maharashtra is one of the worst affected states with COVID-19. And we can see behind you the lockdown is enforced as it is in different parts of the country. Give us the update of how Maharashtra is dealing with the challenge as of now.
Well, absolutely. At this point in time, if you look at the entire state, specifically Mumbai, which has recorded the highest number, the government is implementing lockdown as it was announced earlier also. But in spite of that, people actually on the road here. And so, keeping that in mind, the government has now taken an action and they said that all the vegetable market will now be moved on to open grounds. Right now, I'm in one of the vegetable market here right now. All the shops have been closed here, but the authorities, the police officials along with the commission officials have actually come to the roads and are telling people that they're going to shift this market in a couple of days to open ground, so there will be a social distance people can maintain while shopping here, because that's what the major problem so far. Maharashtra, be Mumbai, be Thane, Pune, Nagpur, these are the areas. And the worst affected is Mumbai, obviously, which has recorded the highest number in the state. And later on, we have seen Pune and Pune, but these are the areas. So as far as the social distance is concerned, this is a major aspect. I want to show you some of the visuals here, where people actually, the authorities actually coming out on the road and showing and telling people exactly what they can do
Right, Shishir.
And they're also telling people that they have to maintain social distancing. As far as talking is concerned, they've told that the morning.
All right, Shishir, thanks very much for joining us with those inputs from Mumbai. From Mumbai, let's go across to Jaipur. Vishal Beristo, my colleague, is getting us updates from Rajasthan. Vishal, how is the lockdown being enforced in Rajasthan? Availability of essential commodities, and what is going on in Bhilwara that emerged as an epicenter of COVID outbreak in Rajasthan? Vishal.
Well, a very good morning to you, Shubhendu. Some good news coming from Bhilwara. 3 persons have tested negative. Now, that's a good news coming from Bhilwara, which is the epicenter of Rajasthan. Meanwhile, let me tell you that the cumulative figure in Rajasthan has gone up to 83 with 7 testing positive, 7 evacuees from Iran. And yesterday, I had a chat with the additional Chief Secretary of Health Rajasthan, and he said that it is very disheartening to note that people are not adhering to the norms of the lockdown. With some or the other excuse, they are coming out and they are trying to violate the lockdown, which is very unfortunate, Shubhendu, because in Rajasthan, let me tell you, that Jaipur, the capital city, is also not safe. 7 police station areas of the walled city, there has been curfew imposed, and let me tell you that 8 in a family have been also tested positive after 2 of the same family. So 10 in a family, that's a huge figure, and that is what is working for government.
Okay. Right, Vishal, there. Thanks very much for getting us those inputs from Rajasthan. There are reporters giving us the inputs. Also, in view of social distancing, instead of an elaborate camera setup, our reporters are using their own mobile phones, using the technology available to reach out to us and also give us the ground reports from different parts of the country. Meanwhile, work from home is not a new concept, we know, for the IT industry, but now it is slowly catching up in other sectors as well. How? My colleague Aisha Khanum reports from Bengaluru.
Capital of India, Bangalore city is observing total lockdown. After 3 deaths were reported in the state, the Karnataka government has strictly implemented lockdown across the state. Just 80 kilometers away from Bangalore, there are 2 districts, Gauribidnur and Chikbalapur, where there are increasing cases of COVID-19. Therefore, the government has declared medical emergency in these 2 regions and also sealed the borders across these both districts. The government is taking care of the migrants and providing them shelter and giving them food and also medical kits. Besides, the Bangalore City Corporation has opened over 31 fever clinics because there was panic among the people when they saw symptoms of fever and common cold in them and rushing to check whether it was coronavirus. So the fever clinics are functioning round the clock to help people allay their fever doubts and also to tell them that they need not worry about fever. The government is also implementing lockdown in many regions across the bordering areas with other states, and it has also successfully managed to bring the laborers from Maharashtra into Karnataka successfully, although the other laborers in Karnataka are being given shelter in many places. The government says the lockdown period will be decided based on the response by the people and how they respond to this lockdown and how they take up this responsibility. Although the central government has said that the lockdown may not be extended, but the state government cautions the people that the decision will be taken based on the behavior and the responsibility of the people in the state. Aisha Khanum, DD News.
Now, in a big development, the centre has decided to extend the validity of fitness certificate permits, driving license, registration and other documents pertaining to vehicles until June 30th. This applies to those documents whose validity has expired since February 1st. The Ministry of Road Transport and Highways has taken this decision as citizens are facing difficulties in the renewal of the validity of such documents due to the ongoing nationwide lockdown imposed to combat COVID-19. As per the centre's advisory, the fact that the Ministry of Home Affairs specifically allowed the transport of essential goods and items was a crucial factor behind the latest decision. All states and union territories have been advised to follow this directive of the Ministry of Road Transport and Highways. This would ensure that transporters rendering essential services and goods are not harassed. Meanwhile, Centre and Delhi government have said that the migrant population issue is now completely under control. Centre has directed states to enforce strict implementation of lockdown. In an official directive to the states, Centre has asked the states to enforce lockdown strictly. Cabinet Secretary and MHA are in constant touch with the state chief secretaries and DGPs. States directed to ensure there is no movement of people across cities or on highways. Only movement of goods should be allowed. DMs, SPs should be made personally responsible for implementation of these directions that have been issued under the DM Act. Adequate arrangements for food, shelter for poor and needy people, including migrant labourers, be made at the place of their work. Centre had issued orders for the use of SDRF funds for this purpose. Sufficient funds are available with the states under this head. States have also been told to ensure timely payment of wages to labourers at their place of work during the period of lockdown without any cut. House rent should not be demanded from the labourers for this period. Action should be taken against those who are asking labourers or students to vacate premises during these testing times. Migrant labourers will also be quarantined at different camps for 14 days. In the wake of the lockdown due to ongoing COVID-19 pandemic, the government has extended the benefit of 2% interest subvention to banks and 3% prompt repayment incentive to all farmers up to 31st of May 2020. Now, this would be applicable for all crop loans up to Rs 3 lakh given by banks that have become due or are becoming due between 1st March 2020 and 31st May 2020. Due to restrictions imposed on the movement of people, many farmers are not able to travel to bank branches for payment of their short-term crop loan dues. Moreover, due to restrictions on movement of people and difficulty in timely sale and receipt of payment of their produce, farmers may be facing difficulties in repayment of their short-term crop loans falling due in this period. Moving on, the government, through a notification, has clarified it has not changed the beginning of the financial year from April 1st to July 1st, as is being claimed by some social media posts. The beginning of the fiscal year 2020-21 would begin normally on April 1st. The Finance Ministry said that a notification has been issued which relates to certain amendments to the Indian Stamp Act. It pertains to putting in place an efficient mechanism for collection of stamp duty on security market instruments, transactions through stock exchanges or clearing corporations authorized by stock exchanges depositories. And let us now look at some good news that give us hope in the fight against COVID-19. The Defence Research Development Organisation (DRDO) has developed a prototype ventilator that can be used for multiple patients. DRDO Chief Satish Reddy said that the model is being improved to include changes suggested by the medical researchers and doctors, and the new version should be ready in just a week. Our correspondent Rudranath Sanyal spoke exclusively to Satish Reddy.
We also have a lot of spin-off technologies which are useful for the civilian society. Particularly in the light of the coronavirus, we have found many of them useful to this particular application.
Defense scientists know how to prepare for unpredictable situations, matters and issues that come up at short notice. So this COVID-19 pandemic has also come with little notice. So how would the expertise of the defense scientists in this realm help?
As you rightly said, the scientists of DRDO know how to work for situations like this and which come up suddenly. I can very proudly say that the laboratories across the country, the scientists are working on multiple solutions and multiple products and multiple technologies in the last maybe about 10 days, coming out with many solutions and which we need to test and validate and all that. And so on, passing on to the industry also very fast, and making the local administration also aware of it quickly, and if possible they are training those people wherever it is required and necessary. Number of products started rolling in. One is the hand sanitizer. We also developed some basically the masks, and then the PPEs, the personal protection equipment, the body suits, whatever we call it. And then we are also talking about the ventilators, then ventilators using for multiple patients, and face masks, and also the full body sanitization also, and some of these things which will be rolling out in the couple of days now.
And to cater to the requirement of oxygen supply for multiple patients during the ongoing pandemic, personnel from Naval Dockyard Visakhapatnam have designed an innovative portable multi-feed oxygen manifold using a 6-way radial header that is fitted to a single oxygen cylinder. This innovation would enable one oxygen bottle to supply to 6 patients concurrently at the same time, enabling critical care management to a larger number of patients with the existing limited resources. The entire setup was made operational by the manufacture of a fine adjustment reducer and specific adapters, dimensions for connecting the oxygen cylinder and the portable MOM. Also, Indian Railways is planning to initially modify 5,000 passenger coaches to meet the requirement of any possible exigency of keeping some corona patients in isolation as and when required by the government. These coaches would be equipped with basic facilities needed for isolation as per medical guidelines. In case need be, more coaches can be modified. Coaches are also going to be equipped with mosquito nets, charging points for mobiles and laptops, space for paramedics. These coaches would be prepared zone-wise. Railways has 125 hospitals in India, and of that, more than 70 are being planned to be kept ready for any eventuality as and when required. Efforts are being made to designate dedicated COVID wards or floors in these hospitals. Approximately 6,500 hospital beds are being made ready to meet possible needs of the patients. And now we bring you an important information. All cable operators must compulsorily show Doordarshan by law. In case your cable operator is not showing all Doordarshan DD channels, please report the issue to this email ID ddpb.inform@gmail.com. Let us now look at some international updates in World Wrap. Now, some positive news has come from the World Health Organization, WHO. In their daily coronavirus situation report, WHO yesterday said no new countries, territories or regions have reported new cases of COVID-19 in the past 24 hours. This is for the first time since the virus started its rapid spread. 58,411 new cases have been reported from the already affected countries in the past 24 hours, taking the total number of confirmed infective cases to 6,93,224, while with over 3,215 deaths reported in the past 24 hours, the total number of deaths globally has reached 33,106. And we were looking at the world data. Now let us look at the data vis-a-vis the most affected countries across the globe as far as COVID-19 is concerned. We're going to, in a tabular form, try and understand the countries which are worst affected by COVID-19. Now, the table coming in front of you, Italy is the worst, and the order is the countries with highest number of deaths. Italy with over 10,000 deaths, Spain with over 6,500 deaths. China has reported, it has stabilized to some extent, over 3,300 deaths have been reported. Italy is also nearly the second highest confirmed cases in the world. Again, the second table that we're looking at number 4 is Iran with 2,640 deaths. France has a similar number of casualties, just over 2,600 casualties in France. And United States, which has the highest number of confirmed cases in the world, over 122,000 confirmed cases, has reported just over 2,100 deaths. So those are the countries worst affected, and we put them in order of the countries where highest number of casualties had taken place. We now get you some expert medical advice in Dr. Speak. And Dr. Shekhar P. Sheshadri tells us what should children keep in mind during the lockdown period when they're at home. Dr. Shekhar is a professor of Department of Child and Adolescent Psychiatry.
घर पे सरल एक्टिविटीज करना, 1-2 घंटे कुछ लिखना कुछ पढ़ना अलग तरीके से, घर में छोटे-मोटे काम में हाथ बटाना, छोटे बच्चे हो तो गुथा हुआ आटा अपने हाथों से अलग-अलग शेप में बनाएं, बड़े बच्चे हो तो उसको बेशक बेलने के लिए काम करें। ये समय है फैमिली को साथ में मिलना, साथ खेलना, कुछ फिजिकल एक्टिविटीज करना।
Remember, elderly people are at a greater risk of COVID-19 infection due to their decreased immunity and body reserves, as well as multiple associated comorbidities like diabetes, hypertension, chronic kidney disease, chronic obstructive pulmonary disease as well. However, COVID-19 transmission among elderly population can be reduced by taking the following measures. Take note of that. The do's include the things that you must keep in mind. Stay at home. Do not cough or sneeze into your bare hands or without covering your face. These are the things you shouldn't do. Don't go near your contacts if you are suffering from fever and cough. Remember not to do these things. Don't touch your eyes, face, nose and tongue. The things to keep in mind that you shouldn't do: don't go near affected sick people because the infection spreads quite fast by physical touch. Also, don't self-medicate. Through telemedicine, contact your doctor and get update on how you should treat your illness. Don't shake hands or hug your friends and near ones. These are the things that you must keep in mind not to do. Also, don't go out unless it is absolutely essential. These advisories particularly stand true for elderly. And those were some of the advices. But remember, as the lockdown is on, stay at home, stay safe, just practice maximum personal hygiene. And that is the way we all can together fight COVID-19. With those updates, we conclude the special presentation. Namaskar.